Hello and thanks for joining me again this week. I hope you've had a chance to thank a teacher for National Teacher Appreciation Week. On Monday, I visited the school where I taught 4th and 5th grades for 17 years, Terrace Elementary School in Tacoma Park. I truly enjoyed my experience teaching in Montgomery County, most days. I got into teaching because I wanted to make a difference in our community. Being in the classroom and representing my school as a union representative gave me that opportunity. During my visit at Rolling Terrace, not only did I get to visit my old classroom and see former coworkers, but I talked to a parent who was a former student of mine. She recognized me and told me that she was dropping off her kids, noticed me talking with teachers and parents, and had to say hi. Many of my former students have stayed in the community, and I've been fortunate to have the opportunity to talk with them and learn about their lives today. I want to thank Dr. Jessica Palladino and her team at Rolling Terrace for welcoming me back, as well as the wonderful students who I met and talked with. I hope everyone joins me in recognizing the amazing teachers of Montgomery County. I want to applaud all the professionals who devote their time and energy to give our young people tools they need to be successful in school and in life. They are there for our students on good days and on difficult days, and over the past few years we've had more than our fair share of difficult days. Through all of this, they've been there for their kids, and I do appreciate them, and I know you do too as well. That is why I was comfortable making a difficult decision to raise the tax rate to address the needs of our students. I want to give a little history on how the need to do this came about. Since the recession of 2010, we have continued to fail our school system when it comes to financial support. Back then, the county got permission from the state to release its funding commitment to schools and to lower the required payment from the county. Had they not done that, we would have had increased spending by increasing it to account for inflation and increases in student enrollment. So this solution saved us from having to cut county services to fund schools. The problem is that rebasing to relieve the recession pressure became permanent, and we never adjusted our spending when the recession ended, and we never restored funding to pre-recession levels and continued to underfund our schools after that. Today, when you adjust for inflation, we're spending about 80% of what we spent in 2010. We've not kept pace with salaries, staffing needs, or building needs. It has impacted instruction at a time when we're facing needs that are increasing, amplified even more by the impact of COVID. Our county used to be a leader in the state and region in funding education, but we can't say that today. The tax increase I proposed is solely dedicated to MCPS, and it would cover salary increases that make up about 3/4 of the cost, and state funding covers the balance. It would still leave salaries and per pupil spending below other jurisdictions in the state, all of which have a lower cost of living than we do. So we face an existential crisis of sorts, a fundamental inflection point. We either bring our spending back in line with our past performance and with competing jurisdictions, or we further handicap the ability of the school system to meet our expectations and our students' needs. If you're concerned about school performance now, not meeting the needs of the school system will not improve the situation. If you're inclined to say that our schools are not like they used to be, part of that may well be because we don't fund them like we used to. Not to mention that the student population and the degree of poverty is also more intense than it was in the past. In the interest of trying to reduce the tax impact, I've proposed to the council a few ways to meet these needs, preserve needed services in our budget, and still potentially decrease the anticipated property tax increase by 2 or 3%. No matter how we ultimately arrive at funding this plan, the fact remains that investing in our teachers and school staff is an investment in families and our communities. We owe our children the best education we can give them. And from a strictly selfish perspective, one of the dividends of adequately funding schools is that it protects our property values, because our school system has been one of the leading factors that motivate people to seek a home in Montgomery County. One way that we can mitigate some of the proposed tax increase is to make sure we're managing our funds carefully. That is why I sent a memo to the council urging them to follow our actuary's recommendation and use some of the OPEB trust fund for its intended purpose, to pay for some of the health care costs for our county retirees. The OPEB trust fund was created to help cover the county's obligation to pay for health insurance of our retirees. The trust fund is healthy and growing. Over the past 5 years alone, it's grown by more than $300 million, or 65%, to over $750 million. It is now large enough that it regularly generates an average of over $50 million annually in investment returns. Our actuary is considered one of the leading actuarial firms in the country. According to their analysis, we can now make some withdrawals from the trust fund and use it to replace between a penny and a penny and a half of the tax rate to pay for retiree benefits now. The amount we'd withdraw would be less than the average annual contribution, so the fund would continue to grow. Currently, we do not withdraw any funds from the trust fund for county retirees. All of the county retirees' health care costs are paid for through the general fund, i.e., our people's tax dollars. It is time to use the trust fund for its intended purpose so that we do not have to look for individual or additional taxpayer funds. This is a significant amount of money, and the physically responsible thing to do is to use some of it. Moreover, the school system does exactly what I'm proposing for its share of the OPEB obligation, and the council has approved this every year. If the council were to apply the same policy they want to follow for the county to MCPS, we'd have to raise our taxes another penny and a half to be consistent. It makes no sense to argue that it's a bad idea for the county, but a fine idea for the school system. If the county were to adopt the change in policy that I proposed to our OPEB process, we could reduce taxes required to fund this budget by between a penny and a half. And since I also support the council's decision to reduce most of the MCPS reserve account by a tax equivalent of 1 cent, the needed tax increase would drop even more. As we come out of the thick of the pandemic, we're still seeing too many families struggle with rising costs of food, rent, and essentials. Part of that can be blamed on reduced work hours. We've noticed some businesses, while they have reopened, are still struggling to return to pre-pandemic levels of revenue, pre-pandemic hours of operation. Families' financial struggles could get worse for some people currently receiving Medicaid. At last count, there were more than 200,000 people in Montgomery County receiving Medicaid benefits. That's a lot of people. This large number is the result of a decision by the federal government during the pandemic to keep everyone on Medicaid without requiring them to reapply. They did this because it was imperative to keep people healthy. Now, almost half of Medicaid recipients must go through a redetermination process, and some may lose their Medicaid coverage if they no longer qualify. This is why we've been working for the last few months to reach out and inform Medicaid clients about the unwinding of this process. We want every person potentially impacted by Medicaid unwinding to update their contact information in the state system so they can receive important correspondence from the state in a timely manner and know what steps they need to take to complete the redetermination process. County specialists are trying to help those losing coverage determine if they qualify for private health plans or county safety net programs for the uninsured. In addition to changes in Medicaid, there have been changes in the Supplemental Nutrition Assistance Program, otherwise known as SNAP. During the pandemic, all eligible households received the maximum allotment, and every recipient saw an increase in their monthly benefit amount. That supplemental benefit ended March 1st, and some households may also find out that they no longer qualify for SNAP benefits at all. This is putting a strain on family budgets. Data from April's Household Pulse Survey from the U.S. Census found families earning between $50,000 and $75,000 a year finding a dramatic rise in food insecurity issues. Only 6% were impacted in March, but that jumped to 26% of households last month. There are currently around 5,000 more households receiving SNAP benefits in Montgomery County every month than in 2019, before the pandemic. The county has launched an Office of Food Systems Resilience to help our departments and nonprofits focus on food insecurity work together and to work on these issues to help families struggling to keep food on the table. This weekend, we celebrate Montgomery History Day with a special ceremony at the Button Farm Living History Center in Germantown. For the past few weeks, it's been home to a Harriet Tubman statue that the public can visit by appointment through the end of May. Admission will be free as the farm marks Tubman Journey to Freedom Day from 10 a.m. to 3 p.m. on Saturday, May 13th. The Underground Railroad hero helped many slaves find their freedom. Historians will be on hand to discuss Tubman's life as a suffragette, and a story time for kids is also planned. I'll be there to present a proclamation and celebrate the life of one of our county's greatest heroes. I hope to see some of you there. Also happening this Saturday, May 13th, adults will have a chance to take part in the Department of Transportation's free e-scooter trainings in Rockville. Participants can take a test ride, learn safety tips, and get details on basic scooter laws. A valid driver's license or ID is required to participate. The clinics are drop-in and no registration is required. The clinic runs from 1 to 3 Saturday afternoon in the parking lot for Montgomery College on Hungerford Road. Those interested in e-scooters can stop by at any time during the 2-hour window. Scooters will be available. You don't have to bring your own. Another Saturday class is set for Saturday, June 3rd in Wheaton. Besides potentially having a lot of fun, these classes also help potential scooter users learn safety skills and get comfortable on an e-scooter. The county's Vision Zero goal of eliminating serious crashes and fatalities on the road by the end of 2030 relies on all road and sidewalk users to safely navigate our streets. Our County Department of Transportation continues to be proactive in making our streets safer and including walking to and from schools. We are in the middle of a comprehensive plan to visit more than 200 public schools for walk safety audits. In COVID-19 news, tomorrow will bring an end to the public health emergency that we've been in for more than 3 years now. While COVID is not completely gone, it is still a threat, especially to many of our most vulnerable residents. And we have effective testing, vaccines, and therapies in place now. As we've mentioned over the last several weeks, Montgomery County will continue to offer free bivalent boosters at our community clinics. Outreach will also continue to help as many people as possible protect themselves with a shot. These vaccinations will also continue to be covered by insurance when you visit healthcare providers. But like other healthcare, you may need to be in network in order for this coverage to be free. Check with your healthcare provider or insurance for details. Free COVID tests and face masks are still available to the public at our local libraries. Face masks are still recommended for anybody experiencing COVID symptoms. We've seen a rise in our case rates over the last 2 weeks, but we have not yet seen a sizable increase in hospital visits. Our community level remains low. One thing I'd like to emphasize is the continuing importance of the vaccine. COVID is now the 4th leading cause of death in this country, and the only cause of death that can be avoided by getting a vaccination. There's really no reason why people should be dying of COVID, other than a refusal to get the protection the vaccine offers. This is sad and tragic, a loss of life, the causing of pain for others who care about a person, and all because the person didn't want to get vaccinated. It shouldn't be this way. I also want to acknowledge that this is National Nurses Appreciation Week. Over the last few years, we've seen the tremendous work and sacrifices nurses have made. They put their lives on the line for others so that we could all be safe and healthy. Thank them for their efforts during the pandemic, and because of their efforts, more lives were saved than lost, and we owe them a special thanks for all they've done. I particularly want to thank nurses that worked for the county. I appreciate all you've done and continue to do. Thank you. And last, but certainly not least, I want to wish all the mothers, grandmothers, aunts, grandmothers, godmothers, and other special people a happy Mother's Day. That's a wrap for today. I hope you have a great week, and I'll be back again next week.